and welcome to your daily COVID-19 update for today, Tuesday, September 6, 2022.
The last 24 hours, we recorded 30 new cases. We're currently tracking 166 cases. And of those 166, we have 11 persons in hospital, with 5 of them at Ocean View and 1 of those at Ocean View. We noticed that a lot of persons who have been hospitalized, after they would have been discharged, a percentage of them can continue to have symptoms at home. If those symptoms persist for more than 3 months, they're considered to have long COVID. So we would advise those persons to come in to see their physicians. And in a lot of cases, for us to manage long COVID, we are required to have a team depending on what symptoms they're having. So different people might have different types of symptoms, and it will take a while before we're able to work with them. Well, first of all, to work with them to make sure that we can help them. So for example, apart from fatigue, a lot of people would have loss of taste, loss of smell. Some people might present with neurological symptoms. They have anxiety. Some of them would have hallucinations. Some of them would forget things. So there's a wide spectrum of symptoms that people would exhibit. And depending on what they're presenting with, we'll get the right expert to work with them. You can take the vaccine even after you have been infected. Whether or not at that point the vaccine would help to prevent long COVID, that's a little bit different, because if you have been infected already, the chances are you can develop long COVID. So at that point, the vaccine would not be very helpful. But if you took the vaccine and then got infected, there have been studies that have shown that the chances of getting long COVID is much more reduced. So I think that distinction, we need to make that distinction so people understand that getting the vaccine gives you that benefit. Well, a simple way is that they're caused by 2 different viruses. So COVID is caused by SARS-CoV-2. Flu or influenza is caused by influenza A or influenza B viruses. In terms of influenza, it's often seasonal. And because it's a viral infection, a lot of people would have runny nose, fever, tiredness, muscle aches, some of which is also very common with persons who are positive for COVID. I think both patients are doing quite well. Maybe sometime this week, the first patient would be discharged, because I think that time period would have come to an end. And then we'll continue to monitor the second patient.
You have been watching the daily COVID-19 update for today, Tuesday, September 6, 2022. I'm Natasha Smith-Thomas. Goodbye.